one example already. So digital design and fabrication of removable and fixed prostheses can also be done to enhance prosthodontic treatment. This will include dentures, crown. We have done one example of application of when we used the single crown scenario just a few minutes ago. So bridges can also, you can incorporate digital dentistry in the production of bridges. Full arch restorations can also be done using digital dentistry. We also have the intraoral scanning and digital jaw relation recording. It reduces the number of appointments that a person can actually come. So once you can incorporate intraoral scanning and digital jaw relations in recording, in your recording, that will reduce the number of times you need to bring a patient in to come and do this and go back, do that and go back. Then you can also do some facial scanning and smile redesign using like the software that we have shown you previously, how you can actually do a preview of a patient's smile to see what their smile will look like after the procedure that you have done, because you are now using digital technologies to actually preview that, and the patient can actually see in advance what their smile is going to look like once this crown is being placed, once the bridge is in place, once the full arch restoration is in place. This is what my smile looks like now. This is what it is expected to look like, and you can do that with high level of precision, and that will bring about patient satisfaction as well. So looking at some benefits that you can get when you apply digital dentistry in prosthodontics, we say that you can use that to reduce chair time and lab visits. Okay, so how many times you bring the patient in to come and sit down, you take impression, the patient come back, you try to fit it, the patient come back, you try to discuss, the patient come back to tell you I'm not happy with this, you try to make amendment. You can actually significantly reduce the amount of time you go forth and back in prosthodontic treatment using digital technology. And then there is higher precision and fit for prosthesis. So when you use digital dentistry, when you apply digital dental tools in your prosthodontic treatment, you can be sure of a very high precision of outcome. You can precisely get an outcome that the patient will be happy with, because you have predetermined what that action will look like, and the patient have accepted that they will be happy with that, and that will fit. If you do get digitally produced all those crown or bridges or any of those restorations, then you can guarantee that they will fit perfectly with minimal or no need for realignment and all of those readjustments that will require that you would have done if you did it all manually. There is improved communication between the dentist and the dental lab when you are doing in prosthodontic treatment. So and this is very important, because just think about what your practice is now if you're not fully incorporating digital tools into your practice. Look at what the communication is. The dentist will do the patient consultation, then will do the impression, and so sometimes the impression might be sent to the lab, and you're not happy with the way the impression is taken. Maybe something wrong and all of that. The communication is not really great. But when you incorporate digital tools into the process, what happens, it enhances communication between the dentist and the lab, and then that also reduces error, because also when the communication is not enhanced, there could be clash between the dentist and the technicians who are producing that. I don't know if how many of you have experienced a clash between the dentist and the technologist over the work that is done. Any experience of that? Any experience of that? If there is problem with the work that is done, who takes the blame? Is it the dentist or the technician? Because what I see here is that the dentist might be blaming the technologist for not doing the work properly, and the technologist might be blaming the dentist, saying, well, what I did was what you sent me. So Ogechi, what did you want to say? Okay, thank you for that experience. So you put a key that will make the dentist not to be able to insert the thing. So are you like in a cold war between the technician and the dentist? That's what it sounds like. I mean, I've worked in practices where the dentist will take the impression, then send it to the technicians, and I can tell you that I did witness some forth and back between the technicians. There are times where the dentist will send the impression, and then there will be some complaints in the dental lab, or who took this impression, what is this, what is the other one, this is not good, this is not that. Or maybe if the work that you produce does not fit very well, then the dentist will be complaining, who did this. Maybe they'll come and call the boss, the chief dental technologist, which of your people did this work, this is not fitting properly, and all of that. And there could be that pressure. However, once you introduce digital technology, it eliminates all of those arguments, because there is high level of precision. If the dentist is taking the what do you call it, the impression using intraoral scanners, you can guarantee 3D visualization of the scanned dental arch, and then the technologists can actually do the design and do the mailing in the office there, and everything will be done without the need for forth and back between the technicians and the dentist. So one example is a dental loss patient can receive digitally designed and 3D printed denture that fits better and are delivered faster than conventional acrylic dentures. Okay, so if you are doing conventional acrylic dentures, then that might take a very long time before that a dental loss patient can have their full denture. The other place that we can also apply digital technologies will be in the area of endodontics. Okay, endodontics, again, if you use CBCT imaging CBCT imaging can be used to assist in dictating complex canal anatomy. Then, you know what we mean when we're talking about endodontics. So complex canal anatomy, you can use CBCT to actually get that. There are a lot of people that start. I know one patient recently that I was speaking with. She was actually my colleague who had a dental problem and had to go to a dentist to actually get root canal therapy. And the dentist did tell her that they are not sure whether they can get to the canal through the canal of her tooth. So, but they will try. Okay, so if they try and can't get through the canal, then they will stop. Instead of doing that root canal therapy, they will now do extraction instead. However, this could have been eliminated if they used a CBCT scan. Your CBCT can give you accurate anatomical analysis of the canal of the patient, so that you can know whether or not this treatment can actually work. Okay, so extra canals and periapical lesions can also be precisely identified with CBCT in endodontic treatment. Also, you have the electronic apex locator and the digital radiographs, which will enhance working length accuracy. So when you are doing, in terms of working length, if you use digital radiograph, you can actually in real time be able to see the length, how deep you are going in the canal and all of that. That can actually give you some level of precision and accuracy in the work that you are doing if you are practicing if you are an endodontist. Also, there is AI-based softwares that can analyze periapical X-rays to dictate root fractures and infections. Okay, so you can actually these days use AI to analyze periapical X-rays to dictate root fractures and infection with high level of accuracy beyond what you would have normally done, be able to identify if you did it manually yourself, as we used to do in the past. Then there is also the case of 3D guided endodontic access, which will be used for calcified canals using the printed guide. So you can use the 3D guided endodontic access to, when you are dealing with calcified canals. That also helps your endodontic work in a digital dental clinic. Some benefits of applying these technologies in endodontics include that you will have improved treatment outcome and reduced failure rates. So sometimes you have patients coming back to complain about their endodontic work. In fact, I've had patients who say instead of them to do root canal therapy, they would rather take off the tooth or go for extraction. Why are they saying that? It could be based on the number of failures that they have had in their previous treatments. Okay, so when someone continues to have repeated failures in their previous treatment, maybe because it might not be the fault of the dentist who is doing the work, it could be because of the formation of their tooth, maybe the calcification of their canal and all of that, and then it's a struggle for the dentist to actually do a perfect job. Then that becomes a problem. But once the dentists begin to incorporate digital technologies into their endodontic practice, then you can guarantee that the rate of failure in their practice will reduce significantly. Okay, there is also enhanced ability to diagnose hidden pathology. When you incorporate this in your endodontic practice, digital technologies can help you to actually diagnose hidden pathology. Like we said just a few seconds ago, I did say that you can actually use digital technologies in terms of analyzing periapical X-rays to detect root fractures and infections. So these are things that you probably would have missed if you did not use digital technology to do the analysis. One example of the application is in a calcified canal in an upper central incisor, which is located precisely. You can locate this precisely using CBCT and a printed endodontic guide. Okay, this will reduce the risk of perforation and procedural complications. So because when you are doing some of these endodontic treatments, there might be risk of perforations happening. There might also be procedural complications that will happen in the process. But once you use something like CBCT to actually assess and analyze the canal of the patient before you begin to operate, then you can actually know the depth, the length, and everything. Do all of these things with a high level of precision, and that will reduce the issues that you will be having in your practice. We can also apply digital dentistry in periodontics. Okay, in periodontal practices we can apply digital dentistry. So we can say that there are digital probes and softwares that record periodontal parameters automatically, and this will do it with high level of accuracy. So if you have a digital probe that you can use to probe along the gum margins, then you can be able to use that probe to record along with the software to record periodontal parameters with precision. And we said that one advantage is that you can actually use this to track the progression of the then if you have a periodontal pocket, for instance, you can use this to track the progression of the periodontal pocket, because you are measuring and recording the periodontal parameters with high level of accuracy, and it is automatically recorded for you. So you don't need to try to figure out what depth, how they calculate the millimeter of it manually by yourself. You can just put that down and it does the calculation for you. Now, CBCT and intraoral scanners can also help you to visualize bone defects, gingival recession, and tissue contours in a 3D form. So you can actually use either a CBCT or intraoral scanner in periodontology. You can use those to actually visualize and have a 3D view of the bone that you are working on, the periodontal area, to assess any bone defect that the patient might have, and that can give you an accurate knowledge of what is happening within the patient. Also, you can apply AI tools which can analyze the bone levels and the attachment loss from radiographs. So you get the radiograph, perhaps the digital radiograph, and then you can use AI to do the analysis of the digital radiographs. Okay, these are tools that helps to minimize human errors and also give you some accurate, precise diagnosis and analysis of some of the things that you would have missed in periodontology. You can also have the custom 3D printed graft template and guide, which will assist in regenerative surgeries. When we are performing in periodontology, when you are performing regenerative surgeries, and then you have to do some grafting and all of that, so you can actually have custom 3D printed graft templates, okay, that after you have done the analysis, before you even go in the mouth of the patient to do the actual surgery, you can use that template to actually guide you when you are doing the regenerative surgery, so that you can actually get the perfect graft size and also place it accurately, and that can enhance what you are doing. Ogechi, do you want to say something? Okay, put yourself on mute. Thank you. So what are the benefits and examples of application of digital dentistry in periodontics? One benefit is that there is enhanced diagnostic and treatment planning. There is better documentation of periodontal progress over time, and this can also it gives you opportunity to have minimally invasive procedure, more precise surgical interventions. So it eliminates you going into the patient mouth, beginning to cut through and then trying to determine in the process of cutting what you will do next. With these digital applications, you can actually design your surgery, assess and analyze your surgical procedure in advance before you actually begin to do the periodontal surgery, especially to make it as minimally invasive as possible. One example is when you can have the guided tissue regeneration procedure, which will benefit from 3D imaging and custom surgical templates design, and then it will increase the accuracy of bone graft placement. Okay, so when you do that and use the template that is 3D printed, then that can help you to reduce those complications. Also, 3D imaging can also be applied in oral and digital technologies can also be applied in oral and maxillofacial surgeries. Okay, digital technologies can also be applied in oral and maxillofacial surgeries, and this includes visual surgical planning. So you can visually plan the surgery before you even go into the theater to begin to operate on a patient. You can do all the planning, do all the mapping, and have a clear picture of what you will be doing when you go into the theater. It enables mock surgery, so you can do a kind of pre-surgery or practice the surgery before you actually do the surgery. And anatomical simulation, you can also do both mock surgery and anatomical simulation to actually be able to simulate the anatomy of the patient, to know what you are going to do, what is going to happen, what it will look like before you go and do it. So all the trial and error is eliminated or minimized to the barest minimum. Now, the application of CBCT in oral and maxillofacial surgery can help with integrated. So when CBCT has integrated software assistant in trauma assessment, it can help the pathology and orthodontic surgery planning. So this is all about the planning of the oral and maxillofacial surgery. So if you use CBCT, which is enhanced with softwares that can assist with trauma assessment, then you can plan with high level of accuracy, look at all the pathology, and orthodontic surgery will be planned before you actually go into the theater to begin to execute the surgery. There is custom titanium implant and plates that can be fabricated using 3D printing. So all the implant that they use, when they do like major maxillofacial surgeries where maybe they've done some bone reduction or extension and jaw reduction or extension, or all of those things that they need the implants to hold, maybe to hold the bones together and all of that. These can be printed with high level of precision using 3D printers, and that can also help in the outcome of the procedure. The surgical procedure will be much better than when they are not used. Okay, so there is navigation assisted surgery and AR overlay, which helps during complex surgeries. So during complex surgeries, you can also use navigation assisted surgeries and AR overlay to help the workflow to be very effective and efficient. So what are the benefits and examples of application of oral digital technologies in oral and maxillofacial surgery? The benefits will include that you will have improved surgical accuracy and reduced operation time, because one of the things that wastes time in surgical operations, especially in relation to oral and maxillofacial surgery, is the amount of time that it takes to figure out what it is you are doing exactly when you are in the surgical environment. However, when the surgery has been pre-planned, pre-visualized before the actual surgery is taking place, when you have done some mock surgery and all of that, then the tendency for you to actually have it with great accuracy is increased. It enhances safety through better visualization of critical structures. So all the nerves, the sinuses can be visualized in advance, and then you know exactly where they are placed. You can know the bone, the strength of the bones and all of that, and then that can help you to minimize complications during major maxillofacial surgeries. Better patient education and consent via simulation. So you can actually simulate the process with the patient, having the patient there during the planning of the process. You simulate it, and then the patient can actually see, the patient can actually consent with accuracy, knowing fully well that this is what I'm consenting to, that is what I'm consenting to, this is what I expect to see after this procedure, this is what I understand that they are going to do to me. That enhances patient's compliance and consent. Okay, one example is for correlative jaw surgery, orthognetics. The VSP allows for digital prediction of post-operative facial aesthetics. So you can actually have a digital realistic preview of the post-operative facial aesthetics. What is this patient's face going to look like after this major surgery? You can create that for the patient to see, and that is like a preview. It's like when you are sending a piece of document to the printer, the printer first, your computer first gives you a preview of the printer of the document, what it's going to look like when it is printed. If you're happy, you send to the printer. If you're not happy, what do? You can cancel the printing and then readjust the document. So that's what they do. It's more like what we said when we talked about digital smile design. When the patient sees the smile that they're going to have after this aesthetic procedure has finished, and then that can be done with accuracy, and the patient already know what they will look like before the surgery. Okay. So digital technologies can also be applied in pediatric dentistry. So we have the digital x-rays. Again, remember when we talk about digital x-rays, we are talking about exposure to radiation. With the normal x-rays, there is exposure to radiation. So when you send a child for an x-ray, then that child is exposed to radiation. But when you do the x-ray digitally, that reduces or minimizing the exposure that the child is going to have to that radiation. Digital dentistry or teledentistry tools are used for behavioral assessment and parental consultation. So when you want to bring a patient into the clinic and I don't know those of you, if any one of you have worked in a special care dental practice before. I work in a community dental practice where we have special care patients, and some of them can actually exhibit behavioral problems. So digital teledentistry can actually help you to assess the patient, the patient, carry out a kind of behavioral assessment for that patient in advance of bringing that patient in, so that if that patient, if there is a member of staff that is more knowledgeable in behavioral management for that kind of a case, you can pre-allocate that person to this member of staff because of the special skills that they have in managing this kind of behavior, because you can make that determination because you have employed digital dentistry to do that assessment for the child. Okay, and you can also do parental consultation in advance before you bring them to the clinic. So you've spoken to the parents, you have a pre-knowledge of what the case is, and you are prepared with the right skill set and tools to welcome the patient into the clinic. So that is one good example of application of digital dentistry in pediatric dentistry. You can also use the intraoral scanning for space maintainer or interceptive orthodontic appliances to avoid gap reflex situation. So in terms of when you need a space retainer for a child, and you know how difficult sometimes it is to get the cooperation of children, but with intraoral scanner you can actually get a 3D image of the tooth of the teeth of the child, and then you can manufacture the space retainer and insert it in place with high level of accuracy without having to go forth and back with the child. And educational apps can also be used to enhance cooperation with young patients as well. So there are so many, if you go on YouTube for instance, there are so many videos that are made for children about the teeth, maybe in terms of brushing. In terms of brushing, there are videos that are made guiding children on how to brush and when to brush, and they're playing all of those games. So there are apps that can do similar things as well to educate children on how to look after their teeth, what to avoid, how to avoid sugar, and getting all those knowledge. And you know what the word is now when children are all over the place using tablets and all these playing games. So there are applications that can be simulated as games, where the children will play games about pretending to be a dentist, or pretending to brush their teeth, or they have a toy that they have to brush their teeth, clean their mouth, know when they can brush, what healthy food they can feed their visual toys, and all, or is it toys or pets or something like that. And all of those things can be for educational purposes, and they are all digital dentistry.